Knee pain can affect both young and mature patients. The young patient may be more prone to an injury that occurs with a athletic activity or sporting activity, or even if they're out playing in the backyard. Whereas most of your mature patients have ongoing chronic knee problems that may require the services of an orthopedic surgeon. Whenever I evaluate a patient, I'm trying to find the conservative approach first, as surgical intervention certainly would be the last thing that would be considered for the knee problem. Conservative treatments for knee pain would include rest, ice, some gentle compression on the knee, and elevation of the limb. Also on top of that, we may use an anti-inflammatory, use physical therapy, and some protected weight-bearing and bracing in some situations. When the problem does not improve with any of the conservative measures, which we do give an adequate amount of time to relieve the problem, then we start to evaluate if surgery is indicated. Surgical intervention in the form of arthroscopy can be considered, or even up to and including knee replacement surgery in the mature patient. The outcomes for surgical intervention are some of the most satisfied patients that we have, and if they weren't, I wouldn't do this.